I'm John Barrasso, United States Senator for Wyoming. Before joining the Senate, since 1983, I practiced medicine in Casper, Wyoming as an orthopedic surgeon taking care of families in Wyoming. So I have an opinion about this health care bill, and every week for the last several months I've been offering my second opinion, a doctor's second opinion about the health care bill. I think this bill is bad for patients, it's bad for payers, the people that are going to end up paying the bill, which are the American taxpayers, and bad for providers, the nurses and the doctors who take care of our patients. You know, the goal of health care legislation was to get down the cost of care and increase access and increase quality of care. I think that this bill is going to be more expensive as a result of the new law. I think that the quality of medicine is going to suffer, and I think that the availability of care is going to be less, as according to this law, they're going to have about 16 million more Americans shoved into the Medicaid system. So I continue to go to the floor with my second opinion and talk about things that are new, unintended consequences that come out each week. You know, as Nancy Pelosi said, that you have to pass the bill before you get to find out what's in it. Well, Americans are finding out what's in this health care law, and they are not happy. Overwhelmingly, Americans want this law repealed and replaced. And just today I was on the floor of the United States Senate talking about the newest basically violation of one of the pledges that the president made. You know, the president has been talking for the last year that if you like your health care, you can keep it. If you like your insurance, you can keep it. Well, now new rulings have come out, and the regulations have been written by, get this, the Internal Revenue Service. And the Internal Revenue Service, along with the Department of Health and Human Services, says under their new regulations, over half of the Americans who receive their health care through their work, we're talking about half of 170 million Americans, over the next 3 years will lose the insurance that they want. There you have it, a President Obama promise, once again the American people facing a broken promise. So I'm going to continue to go to the Senate floor every week with a doctor's second opinion about a health care law that I believe fails to address the root causes of the increased costs of health care in our country, and that will end up being bad for patients, bad for payers, and bad for providers. To the floor today to offer my second opinion on this health care bill. I've been doing this week after week as we've had a year-long debate and discussion of a health care bill that has now been signed into law. And I come to the floor because it seems, Mr. President, that every week since the bill became a law, there has been a new revelation, a new unintended consequence that the people of America look at and say, this is a bill, now a law, that was not passed for me. It's to help someone else. And the promises that the American people have heard when the bill was being debated and discussed, we are now finding that those promises have been broken. And again this week, one of those major promises, a fundamental behind the health care law, has been broken. And the American people are concerned and distressed because it affects them personally. They feel they were misled. You know, the goal of the health care legislation last year was to lower the cost of health care. Agreement all across the country, we need to do that. We need to lower the cost of care. To improve quality of care, absolutely. It's in the best interest of all Americans if we can improve the quality of care. And then, of course, to increase access to care. The more we can do to allow more people in this country to have access to care, the better it is. Lower cost, improve quality, improve access. Well, that's not what this Senate chamber passed, because I believe that the bill that was passed is clearly not going to lower cost, and the Congressional Budget Office agrees. It's not going to improve quality, and it's not going to improve access, as we see even from statements from the Secretary of Health and Human Services about the shortage of primary care providers, the shortage of physicians and nurse practitioners and others to help in this. So I continue to believe that the law that we now have passed is bad for patients, bad for payers, the people that are going to pay the health care bill of this country,
and bad for providers, the nurses and the doctors who take care of those patients. Because I believe that the law fundamentally is going to result in higher costs for patients, less access for care, and unsustainable spending. You know, the Speaker of the House, Nancy Pelosi, said that you're going to have to first pass the bill to find out what's in it. And once again, this past week, we have learned about something new that is in the health care law that many, many Americans have found surprising.